Good evening, everyone. This is just a quick presentation to show you illustrate healthcare funding from the government all the way to flow. So you're seeing here the NDP, which would be the ruling government, would provide the transfers to the provinces. The provinces then would provide transfers to the private sector or to the hospital in general. That's why I've got listed a hospital image, a home care provider, and a long-term care facility to show you where the money should end up in the bottom line. So the $42 billion at the end of the NDP mandate should flow directly down to frontline services as part of the funding of healthcare. So basically that's why I wanted to kind of illustrate that. The bottom part of it is I picked on Ontario for a reason. Ontario is the largest province, and it's an area just to kind of show you what's happening. So you will see basically based on Mulcair's funding, you will see by the end of the 2019-2020 mandate there'll be $16 billion more in healthcare dollars going to Ontario, which is about a $3 billion increase. Now let's stop there for a second. Now part of any sort of funding relies on basically the healthcare accord, which is negotiated. It's basically a negotiation between the provinces and the federal government. That is something Mulcair's brilliant finance minister, Mr. Andrew Thompson, said needs to be negotiated, and he seems to be wanting to dictate some terms. But again, he was very evasive on the CBC interview about that in terms of what that really entailed in terms of the next healthcare accord. So the second point I wanted to bring up is the actual ministry where the money comes as a pooled fund, which is in Ontario's case is the Ministry of Healthcare and Long-Term Care. So you're basically, I could only pull basically the 2013-2014 numbers based on their annual report, and what I noticed, the growth between the previous year was about 3%. Yet Stephen Harper is giving healthcare 6% growth to the provinces. So where did the other 3% healthcare dollars go? You know, it's easy to blame Harper for things, but what do you do when you got a government like Kathleen Wynne that doesn't put all that money into healthcare? The third arrow you're seeing there is actually Helium Health Partners, which is a hospital group in the Mississauga. Now the numbers are a little bit off there, but that's to do with a funding change that happened. That was a one-off change in 2015. But their funding has basically been held, from my analysis, between 1.5% to 2% growth each year. So if the hospitals are only seeing 2% of that growth, and yet the government overall is seeing 6%, so where did the 4% go to? This is something that's never discussed from Thomas Mulcair in terms of how the funding is not trickling down, or the fact that we've got other issues related to bureaucracy at hospitals, or even the fact that we're not even looking at innovative ways to deliver healthcare. It's easy to throw money at a problem, and that's what Mulcair is doing.